Together we achieve victory over heart failure.
Hello everyone, I am Dr. Vivek GC. I am a consultant cardiologist. I am working in Sri Jayadeva Institute of Cardiovascular Sciences, ESA branch. So today we'll be discussing about monitoring your heart failure conditions, the topic which is. So let us first dwell into the critical aspects of the healthcare, which is the monitoring of heart failure condition. As we know, it is very difficult to notice heart failure right away. So initially, our heart faces increased strain and it compensates by working harder. When the heart failure progresses, its ability to pump the blood gradually diminishes. Over time, these subtle changes can go unnoticed, and this is why we emphasize on recognizing the heart failure symptoms earlier. So initially, it can start off with the swelling in the feet or ankle, and then it can progress into the abdomen, and which can give rise to a sudden weight gain. These are one of the common signs of heart failure. So thereby, the monitoring your weight becomes one of the important aspects in detecting the early symptoms of heart failure. The shortness of breath which occurs during daily activities which was not there before, and any interruption in breathing, especially like persistent coughing or wheezing, also requires medical attention, as it can be a sign of heart failure worsening. So many patients come with a wheeze and a cough which can be confused with a respiratory cause, but on the other hand it can be a heart failure condition as well. Some patients also complain of difficulty in sleeping, which can indicate a heart issues. And once the cardiac flow to the brain reduces, patients can have symptoms like fatigue, confusion, or fainting, which are one of also the symptoms. So other symptoms include rapid heart rate and decreased appetite and nausea. And if these signs appear, it's time for you to seek prompt medical care. So let us now, apart from now that we discussed about the symptoms now. So now let us discuss about some of the key heart numbers which you should be aware of. There are certain aspects which determine how the heart is undergoing a stress. So one of the most important thing is the blood pressure. High blood pressure is harmful because it makes the heart work harder and less efficiently. So this high blood pressure can easily be detected by the patients with having a sphygmomanometer digital one at home. So elevated blood pressure of more than 120 by 80, especially in heart failure patients, should be checked. We try to keep it less than that. And next crucial number to understand is your cholesterol levels. So these cholesterol levels can cause depositions in your arteries and cause blockages. Hence, reduction of your cholesterol level becomes extremely important. So there are certain values which you should be aware of. So for people who are 19 years and younger, LDL cholesterol should be less than 110, which is the bad cholesterol. But on the other hand, the HDL cholesterol, which is the good cholesterol, you need to keep it above 45 milligrams. So for men who are 20 years or older, we keep the LDL cholesterol lesser than 100, HDL cholesterol more than 40. For women who are 20 or older, we keep the LDL cholesterol less than 100, HDL more than 50 milligrams. This is regarding the cholesterol aspect. Now coming to the heart rate or the pulse, your heart rate is the number of times your heart beats per minute. Your resting heart rate is the lowest rate your heart beats when you're not exercising. It is usually for normally between patients for between 60 to 100 when you're calm, relaxed, and not ill. On MOT, so for when you're targeting exercises, you have to aim at 50 to 80% of your maximum heart rate. For instance, maximum heart rate is calculated by 220 number minus your age. Supposedly, your age is around 20. So the upper maximum heart rate comes to around 200. So you have to aim exercise which reaches 50 to 85% of your 200 number. So many wearable activity trackers will help you monitor the heart rate during exercise and throughout the day, helping you keep tabs on your cardiovascular health. This concludes today's discussion on monitoring heart failure condition. Remaining proactive is the key to safeguarding your heart from heart failure. Thank you very much.